is that we have invested a huge amount in nuclear deterrence, but we've actually invested very little in a system to stop an epidemic. We're not ready for the next epidemic. You can have a virus where people feel well enough while they're infectious that they get on a plane or they go to a market. The source of the virus could be a natural epidemic like Ebola, or it could be bioterrorism. So this is a serious problem. We should be concerned. Germ games, not war games, so that we see where the holes are. The last time a germ game was done in the United States was back in 2001, and it didn't go so well. So far, the score is germs 1, people 0.
Tank of oxygen that only had 30 minutes of oxygen in it. And I go, well, how am I going to get home? Can you give me a bigger canister or fill this one up more? No, we can't. You mean, so I got to race home with only 30 minutes of oxygen.
Well, it was a bad traffic day, right?
Yeah, I mean, and the house was normally 45 minutes away.
Yeah.
So I said, well, I'll kind of take my chances.
Step on it, yeah.
And on the way home, I just had my head out the window, trying to get oxygen that way. And it already, by the time I got there, it was already out of oxygen, and my wife read the instructions really fast on how the thing worked and got me on the oxygen concentrator.
When I asked them and they were closing, they wouldn't even give me the test. Headed back to the pharmacy, waiting for them to open. And so begins my saga to try to get a COVID test so that I can fly home. Coming to France required no test at all, but to go back to my own country, they require that I have a test done within 24 hours of flight.
And I think what one of the major problems was that there was too much information going around. Some of it was correct and some of it was misinformation, and some of it was deliberately meant to complicate the situation.
I'm losing everything. Everything I own is being taken away from me. We need somebody to do something about this.
Welcome to Public Health Perspectives, the COVID story. My name is Dr. Jeffrey Tipton. I'm a board-certified preventive medicine and public health physician. In this documentary, we will be covering the public health response to COVID in the United States. We will look into how we succeeded handling COVID, how we failed, how other countries handled COVID, and did they do a better job than us? We have all been impacted by COVID. Economically, we've had family, friends who've gotten sick and died. Even the people who had COVID and recovered are still dealing with the after effects of COVID. It's hard to say where COVID will land, but I can assure you we'll have another epidemic in the future, and we can do a better job handling epidemics. Hopefully at the end of this documentary, you'll have a better understanding of how our public health system works, of how epidemics go, how the public health system reacts. So when the next one comes around, perhaps you can get involved and make the whole process go much better. So what is public health? According to the American Public Health Association, public health promotes and protects the health of people and the communities where they live, learn, work, and play. Our public health system is supposed to be there to give communities, states, and the nation the capacity to prevent disease, promote health, and prepare for and respond to both acute threats and chronic challenges to health. Every state has a public health department, and there are over 2,800 local health departments in the U.S. And of course, there's the good old CDC. Some of the public health system responsibilities are diagnosing and investigating health problems and health hazards in the community, informing, educating, and empowering people about health issues, mobilizing community partnerships, and enforcing laws and regulations that protect health and ensure safety, such as clean water and air. And public health departments are expected to take the lead when a new infectious agent comes on the scene and come up with a plan to make sure that this new infectious agent doesn't get everyone sick or kills everyone.
Public health systems have responsibility in terms of infectious disease. First of all, for recognizing the occurrence of a new outbreak or repeat of an old outbreak. So they have the responsibility to monitor not only for existing infectious agents like flu, but monitoring for new agents that they didn't know about before. And of course we have we had HIV and we had Ebola, and now we have SARS-CoV-2. And ultimately it's the responsibility of public health to control the epidemic. But in order to do that, they've got a responsibility to inform the public. They also have a responsibility to inform the political system, because in the end, much of public health intervention is politics, because it requires changing of behavior.
And there are many complaints and concerns that our public health system does not get enough funding. In 2020, the CDC budget was $7 billion. The Department of Defense budget was $700 billion, but it is estimated that around $90 billion is spent annually on public health in the United States. So there's plenty of money to take care of things, but money oftentimes isn't the main problem when things don't go well. The healthcare system in the United States is complicated. There are doctors, hospitals, insurance, and drug companies. It's hard to navigate all the moving parts of the healthcare system. And public health is part of that system as well. Our healthcare system is split into different sectors. There's a private, a public, and voluntary sectors. Private and public sectors supply insurance and care to most Americans. In the private sector, people get insurance through their work. On the public side, we have entitlement programs such as Medicare, which covers elderly Americans, and Medicaid, which covers Americans below a certain poverty threshold. The government also provides health care through things like the VA and the Bureau of Indian Affairs, and takes care of people in prison as well. The voluntary sector includes charitable organizations that do health research and provide free or low-cost health care services, like the American Cancer Society or the March of Dimes. The Bill and Melinda Gates Foundation provides billions of dollars worth of aid to many healthcare non-governmental organizations. Close to $1 trillion is spent on healthcare in the United States every year, but that doesn't make it good. The U.S. spends more of its gross domestic product on healthcare than any other high-income country, yet ranks last in access to care, administrative efficiency, equity, and healthcare outcomes. The federal government has the biggest role and stake in protecting and maintaining the health of the country. They set the tone. They have the money. COVID-19 quickly became a federal issue when the federal government learned of the outbreak in China. So let's try to cover a few thousand years of public health history in a few minutes. Humans have been on this planet for around 100,000 years, and during this time, people have lived and people have died. Certainly in the early years, when someone died, the cause of death was often unknown. Of course, unless somebody was getting hit in the head with a rock, then it was very clear how they died. But certainly in early human civilization, these causes of death were a mystery to most people. The ancient Greeks got the whole public health thing going by being into fitness, health, nutrition. They came up with the Olympics. They saw that oftentimes disease or illness was caused by the environment that was around somebody. Hippocrates was an ancient Greek. He's considered by many to be the father of Western or modern medicine. He came up with the term epidemic, which means on the people, and he had the Hippocratic Oath. The Hippocratic Oath is basically a rule or a guide for physicians that if you're treating a patient, if you don't know how to help them, certainly don't hurt them. Next, we had the Romans. They believed in a lot of the things that the Greeks did, healthy living, etc. But, they were engineers. They were major engineers. They constructed aqueducts to move the water around, sewage systems. They were into administration. When they came to a place, they took it over and kind of took control of it. Next, we had the Middle Ages or the Dark Ages. These were bad years for public health. The Black Plague came around and wiped out a big chunk of the population. That's a disease where rats were spreading a bacteria to humans and killing them. During this time, too, religion kind of trumped science. Basically, people began to believe that, people were getting sick or dying because they had offended God in some way. And so scientists were pushed out. There were some advancements such as quarantine and isolation of diseased patients, but overall, it was a pretty bad time. Next was the Renaissance, which certainly was much better than the Dark Ages. But during that time, people sailed around the world from Europe, and they brought with them all kinds of diseases, smallpox, STDs, tuberculosis, and basically they wiped out most of the indigenous populations where they landed. Then we had the Age of Enlightenment, and that brought further advances in medicine and science. During that time, Dr. Edward Jenner developed the smallpox vaccine after doing a very studied analysis of how people were contracting this disease, and the microscope was invented. During the early 1800s, Dr. Snow arrived. He's considered to be the father of epidemiology and helped develop a lot of the principles and practices of epidemiology. He helped determine the cause of a particular cholera outbreak in London, and using his methods, ended that cholera outbreak, saving thousands. He developed guidelines for handling epidemics. One is determine what the disease is, look for possible causes of the disease, look for potential sources of that disease. If you have a treatment, begin treating people, then back and look at that source and make sure that's being controlled. Stop the spread by doing things like quarantine and isolation, and then come back around again and make sure that this disease does not come up again. Then we had Louis Pasteur. We've all heard of pasteurized milk. That's the guy. That's the Pasteur. He developed an understanding that microorganisms were the cause of many diseases. He also developed a rabies vaccine. Along with him, we had Robert Koch, and he was very good at identifying microorganisms. Again, this is where the microscopes came into play. He identified the Vibrio cholera bacterium and also the tuberculosis bacterium. Once all this knowledge started to come together, there was a bit of a sanitation revolution led by public health departments. Public health departments and other government entities made sure that the water was safe to drink, inspected food, and continued to promote personal hygiene, developed treatments for various diseases, vaccines, etc. Made sure the garbage was being collected, tried to control rodents and other sources of infection. And again, most of this was led by public health departments. Public health departments took the lead in controlling communicable diseases. So what are viruses? Living creatures? Not really. Viruses are microscopic particles that exist almost everywhere on Earth. They are present in animals, plants, and other living organisms, and sometimes they can cause some serious diseases. Viruses are biological entities that can only thrive and multiply in a host. That host is a living organism. And a virus may affect one organism in one way, but a different one in another. For example, a virus may get a cat sick, but the same virus won't get a human sick. Viruses consist of genetic material with a coat of protein around them. Once they get into a host, they replicate. What's their game plan? Nobody knows. They don't talk, so you can't ask them. Smallpox was one of the first viruses to impact humans, and it was a biggie. 3 out of 10 people who got it died, and those who lived were left with horrible scars. It is estimated that smallpox killed around 300 million people during its time. In the 1800s, Dr. Edward Jenner developed the first smallpox vaccine, and that was the beginning of the end for that virus. In 1959, the World Health Organization decided to put an end to smallpox, and by 1977, it was over. It was gone. So see, people can get together and get rid of viruses. The first good understanding of viruses began in the 1890s. Russian botanist Ivanovsky experimented with the tobacco mosaic virus and discovered that the sap from a sick tobacco plant could make another plant sick. Then Dutch scientist Bijerinck proved that the agent causing the tobacco leaf infection was not a bacterium and called the causative agent a virus, a Latin word meaning slimy, poisonous liquid. In the early 1900s, Dr. Walter Reed got involved in the virus game in his exploration of the causes of yellow fever, a viral disease that also killed millions. He discovered that mosquitoes were responsible for spreading the disease. In 1908, Ellerman and Bang demonstrated that leukemia in chickens was caused by a virus. And then in 1918, we had the misnamed Spanish flu. No, Spain was not the country of origin for that flu. That flu killed close to 1 million people in the United States, mostly people between the ages of 20 and 40. At that time, the population of the United States was 100 million. It is estimated that that flu killed around 30 million people worldwide. Flu comes from the Italian word influenza, which means to have an influence, and boy did it ever. And yep, back in those days they had masks, but there were still people who thought that wearing a mask was an affront to their liberty. And they had isolation and quarantine, but just like today, people got tired of that and then soon attended events together, and those events became super spreader events. In 1931, the German engineers Ruska and Knoll created the first electron microscope, and that microscope allowed them to see viruses for the first time. In 1935, virologist Wendell Stanley examined the tobacco mosaic virus and found it to be made mostly of protein. In 1932, the first flu vaccine was created. In 1952, Hershey and Chase showed that it was the nucleic acid portion of the virus that was responsible for its infectivity. In 1953, Jonas Salk developed the polio vaccine. In 1954, Watson and Crick found the exact structure of DNA. Then in the 80s, the HIV virus came around, and that was a tough one to figure out. Unfortunately, it killed millions and still kills people before an effective treatment was found. We still do not have an HIV vaccine. In 2002, we had our first experience with the SARS virus. That virus had a very high case fatality rate of around 10%. It started in China and then soon spread across the world, but really was held in check by public health measures. The world really came together to knock down this SARS virus.
Those of us who work infectious disease sort of call on our experience with other infectious diseases. There are certain general rules about how infectious diseases behave. Well, SARS-CoV-2 hadn't read the book. And so we were confronted with the disease that was behaving in ways that we had not seen before. And so we had to struggle with how to cope with that information. And this also then complicated the situation with the public because they're used to public health officials being able to say, this is it, this is right, this is correct, as we do influenza. We've got lots of experience with influenza, so we know what to say. We know how to communicate and that sort of thing. With SARS-CoV-2, we'd never seen an epidemic quite like it. There had been 2 prior epidemics caused by coronavirus, but both of them fizzled out on their own. And it was pretty clear that SARS-CoV-2 wasn't going to fizzle out on its own. And we're learning that it mutates, and we're used to the situation where you get infected with an infectious disease agent, and if you survive, you get immunity. and so you're protected against reinfection. Well, that's not true for SARS-CoV-2. And the degree to which one can be reinfected and what are the predictors about whether you're going to be reinfected, we haven't resolved completely.
So what is COVID-19? COVID-19 is a coronavirus. Prior to SARS, coronaviruses were known to be the cause of the common cold. They are called coronaviruses because under an electron microscope, their outer shell looks like a crown. They became lethal viruses when they mutated and became responsible for the first SARS epidemic. SARS is severe acute respiratory syndrome. Coronaviruses infect birds and mammals. Bats are often the host of many coronaviruses, but bats don't get sick from these viruses. People infected by COVID-19 can have a variety of symptoms, and some people have no symptoms at all. Some of the symptoms are respiratory, with cough, sputum, shortness of breath, and fever. There are musculoskeletal symptoms with muscle and joint pain, headache, and fatigue. And people get digestive symptoms with COVID, things such as abdominal pain, vomiting, and diarrhea. Loss of smell is a cardinal sign, and around 88% of symptomatic people lose their sense of smell. COVID-19 gets in your body, attaches to a receptor on the cells for an enzyme called angiotensin converting enzyme. Once attached to the cell, COVID-19 shoots its RNA into the cell. Then the cell starts making copies of the virus. Those copies head out into the circulation, then attach to more cells, and then the cycle gets repeated over and over and over. The respiratory tract is most impacted by COVID, but COVID attacks other types of cells and organ systems as well. It does work its way into the brain and destroys brain tissue while there. This is why some COVID patients end up with memory loss and other cognitive dysfunction. It does directly damage heart tissue and causes other problems with the circulatory system, resulting in clots. COVID is transmitted when people breathe in air contaminated by droplets and aerosols and small airborne particles containing the virus. Infected people exhale those particles as they breathe, talk, cough, sneeze, or sing. Transmission is more likely when people are physically close by. However, those particles can travel as much as 20 feet and be suspended in the air for hours. Unfortunately, infected people can spread COVID even before they're symptomatic. Once symptoms begin, then people are highly infectious, but still can be infectious even after 20 days after symptom onset. You can theoretically contract COVID by touching a surface contaminated by COVID, but such transmissions are rare. One person infected with COVID will infect around 3 others. There are several ways to test for COVID. One of them is the antigen test. That's the type of test that you might get in a doctor's office or the kind that you pick up at CVS, these home test kits. Those tests look for a portion of the capsule of the COVID virus. The other type of test is the PCR test that we hear about. Those tests look for the COVID RNA virus, and such samples are sent to a lab where they undergo a technique called polymerase chain reaction to amplify the amount of RNA virus that is there. PCR tests will often show positive a couple days before an antigen test will. We will discuss the sensitivity and specificity of such tests later on in this documentary. There are also blood tests that are used, and those show your antibody level or whether or not your body has made antibodies to the COVID virus. So COVID-19 is a cold virus that went a little crazy. When it gets into the body, it causes a lot of damage, especially to the lungs. SARS, severe acute respiratory syndrome. Here's a brief history of COVID. There's a lot of history there, so it's not all that brief. On December 12, 2019, a cluster of patients in Wuhan, China, began to experience shortness of breath and fever. On December 31st, 2019, the World Health Organization is informed of a number of cases of pneumonia of unknown origin detected in Wuhan. The cases seem to be connected to a seafood wholesale market there. China had already begun their lockdown a couple weeks before that. On January 25th, 2020, the CDC activates a center-level response for novel pneumonia of unknown etiology. On January 7, 2020, Chinese authorities identify and isolate a novel coronavirus as the causative agent of the outbreak. January 10th, the CDC publishes information about this virus. January 15th, Japan has its first case of COVID. January 17th, the CDC begins screening passengers on flights coming from Wuhan at San Francisco, New York, and LA airports. Of note, my friend's wife was in Wuhan, China during that time, and she came back to LAX on January the 20th, and she was not screened for COVID. But he knew about COVID, so he had her put up in a hotel for 10 days. On January 17th, we have our first COVID case in the United States in the state of Washington. January 21st, the CDC activates its emergency response system. January 22nd, the WHO confirms human-to-human spread of the coronavirus. January 22nd, the World Health Organization convenes a big meeting to discuss the coronavirus and decides to not do anything at that time, just wait 10 days to rediscuss. On January 31st, the U.S. Secretary of Health and Human Services, Alex Azar, declares a COVID emergency, and at the same time, a travel ban to the U.S. from most European countries and from China. U.S. citizens in China were allowed to return, as were permanent residents, so not a total ban. On January 31st, the World Health Organization finally declares COVID outbreak a public health emergency. On February 11th, the World Health Organization decides to call this coronavirus COVID-19. On February 8th, the CDC sends test kits to a laboratory in Manhattan, but the tests end up being unreliable. On February 23rd, Italy is in a lockdown. On March 11th, the WHO declares a COVID-19 pandemic. March the 13th, President Trump declares a nationwide emergency. On March the 15th, various places in the United States begin to shut down, including public schools. March the 17th, a human trial with the Moderna vaccine begins. March the 26th, the CARES Act is approved, providing $2 trillion in aid to hospitals, businesses, and state and local government. March the 28th, the FDA issues an emergency use authorization for hydroxychloroquine, a drug that was never proven to work. April 3rd, the CDC recommends that all people wear masks outside the home. By April 13th, COVID had spread across the entire United States. April 24th, Georgia, Alaska, and Oklahoma decide that they're going to partially reopen their states. April 30th, President Trump launches Operation Warp Speed to get vaccine out quickly. On May the 1st, the FDA issues an emergency use authorization for remdesivir. In the subsequent 18 months, remdesivir is determined not to work. On May the 9th, the U.S. unemployment rate is 14.7%, the worst rate since the Great Depression. By May the 28th, the COVID death toll had surpassed 100,000. By September 22nd, the death toll had surpassed 200,000. On October the 2nd, President Trump tests positive for coronavirus. On October 7th, New Zealand declares itself virus-free. In December of 2020, the Pfizer and Moderna vaccines are rolled out and people start to get them. January 18, 2021, 400,000 people had died from COVID. March the 8th, 2021, the CDC announces that fully vaccinated people can gather indoors without masks. March the 19th, the CDC says kids can socially distance from 3 feet instead of 6 feet. By June 2021, the Delta variant had showed up, and a new wave of hospitalizations and deaths occurred. In July of 2021, we started to see breakthrough infections, which meant that the vaccine wasn't working as well as people thought it was going to work. By October, booster shots were being recommended, and in November of 2021, Omicron showed up.
The recent SARS-CoV-2 epidemic really illustrates the problem and the need for communication.
So what was our response to COVID, and what should it have been? Responses to infectious disease outbreaks can be broken down into 3 main categories: organization, science, and communication. More simply, What is it? How do we know what it is? What does it do? How prepared are we to respond? Who does it hurt? Can we stop it? How do we stop it? Can we prevent it? Once here, how do we measure cases? How do we know who has it? How lethal is it? How do we prevent it from infecting others? Do we have a vaccine? Who gets a vaccine? What about masks? Who gets the masks? Should we shut the country down? Lastly, who is in charge? How much power do they have? Who is communicating all this information, and are they trustworthy? Early on in the epidemic, the CDC determined what a positive COVID case is. There were probable cases. Those were people who had all the symptoms, signs of COVID, yet did not yet have a positive COVID test. And there were confirmed cases. Those are people who had a positive COVID test. Both of those scenarios counted as a positive COVID case. So the analytical study of this COVID outbreak is epidemiology. Epidemiology is a study and analysis of the distribution patterns and determinants of health and disease conditions in a defined populations. Most public health departments have epidemiologists. An epidemiologic investigation involves the collection and analysis of facts or data to determine the cause of illness and to implement control measures to prevent additional illness. Being prepared is essential to success in responding to an infectious disease outbreak. So, were we prepared? Well, we had a very significant written plan for dealing with COVID-like emergencies. We even did a 6-month-long training exercise at the federal, state, and municipal level in 2019 called Operation Crimson Contagion, an exercise that ironically simulated a U.S. response to a fictitious respiratory virus that began in China and quickly spread around the world. Here are some of the findings from that simulation. The Department of Health and Human Services at the end of the training determined the U.S. is underprepared, underfunded, and undercoordinated to fight an influenza-like pandemic. The exercise highlighted the lack of PPE preparedness in the event of a global pandemic and problems in the supply chain for medical equipment, including ventilators and other ancillary medical supplies. In this fictional pandemic, as the virus spread quickly across the U.S., the CDC issued guidelines for social distancing, and many employees were told to work from home. But federal and state officials struggled to identify which employees were essential and what equipment was needed to effectively work from home. There was also confusion over how to handle school children. The CDC recommended that states delay school openings, but some school districts decided to go ahead with the start of school while others followed the federal advice, causing the same types of confusion and discrepancies that marked the response to the coronavirus. The organizers quickly realized that the U.S. did not have the means to quickly manufacture more essential medical equipment, supplies, or medicines, including antiviral medication, needles, syringes, N95 respirators, and ventilators. That exercise ended in October of 2019, and nothing was done, and a few months later, COVID hit. This exercise also showed that we are a country of 50 states with more than 50 ways of doing things. If the federal government says, shut your state down, then many of the states answer back, who are you again?
The public health officer in the public health system actually has power to lock people up and to enforce regulations for public health in the interests of the public. Arizona and several of the other conservative states have now passed a law and said, no, not anymore. That's going to be determined by the governor. So, I mean, that's a frightening thought.
Yeah.
The governor is going to determine public health policy. It's particularly important to get the political leadership behind you. I would, again, underscore it. If you can't get the political leaders behind you in terms of what needs to be done to control an epidemic, then it's not going to happen.
We are a country of tremendous resources, especially at the federal level. It's not a big deal for us to make and store billions of pieces of PPE, but we did not act on this opportunity to do so. And when the pandemic hit, it was impossible to play catch up. As noted, unfortunately, China was not forthcoming with the extent of the epidemic there, the exact cause, the lethalness. No info to us or the World Health Organization for a month. Sure, we should have been prepared, but this made things much worse. And while they locked down people living in Wuhan, they did not stop potentially infected people from traveling to other parts of the world. In January of 2020, a man traveled from Wuhan to his home in Seattle, and he became the first recorded case. Many of the first cases in the US were people who traveled from Wuhan. As previously noted, on average, COVID-infected patients will infect 3 others. Once it started, it was very hard to stop it. So once it was clear our country had some cases and the people who had COVID were pretty darn sick, we turned to what are we going to do about it? One of our first moves was to develop a test for COVID, and the CDC took the lead on that, and they screwed it up.
CDC didn't respond as effectively as it could have. I think in retrospect, there are some things they could have done they didn't do.
Speed was critical in this early response to COVID. So important to identify those early cases. The World Health Organization, China, Britain, South Korea, even Russia all had functional tests before we did. The rollout of the CDC-designed test kit to state and local labs quickly became a fiasco because it contained a faulty reagent. Presently, we have antigen tests and PCR tests, or nucleic acid amplification tests, from mostly private manufacturers. The tests are pretty good, but they're far from perfect. There are those false positives and false negatives. People often ask, how good is this test? How accurate is it? A test is considered to be accurate if it compares well to a gold standard. In the case of COVID, it's the PCR test. In the world of testing, there are true positives, false positives, true negatives, and false negative. Those values determine the sensitivity and specificity of a test. Sensitivity means if you have COVID and the test is positive, then it is sensitive. It's a true positive. Specificity means that if you take a test for COVID and it's negative and you don't have COVID infection, then it is specific. PCR tests are very accurate, or they're good tests, as long as they don't do a lot of amplifications to get to the result. Antigen tests are pretty accurate as long as you do the test twice. For example, you take it one day, it's negative. You should take it again 2 days later if you're symptomatic. So, how many people have been infected with COVID in the United States? We don't actually know, because somebody could be infected with COVID and not take a test, and then we never knew that they were infected. In June of 2022, we have around 100 million positive COVID cases in the United States, and around 1 million people have died as a result of COVID. So on the organization front, we did poorly. Aside from the bungled communications, it was clear there was poor planning, infrastructure, and cooperation among agencies. Also, if we had a better relationship with China at the time of their outbreak, maybe they would have given us a heads up on what's going on. We could have gotten ahead of the curve. It took us months and months and months to get ahead on testing. South Korea, on the other hand, well, they kicked our butts. It got so bad that we were actually turning to them for tests in 2020. South Korean officials had a plan. They decided that they needed to test as many people as possible, as quickly as possible, to figure out how bad the outbreak was. Then they had to find out who might have come in contact with the infected people. They decided that they needed all those people, both infected and potentially exposed, to isolate themselves to prevent the virus from spreading any further. They mobilized and had widespread testing, isolation, and quarantine while we were still in our pajamas. They had a 3-step protocol: test, trace, and isolate. And they tracked test results through a nationalized system. No, South Korea is not a dictatorship. It's a democracy, just like us. Their entertainment and automotive industries are also very strong. Well, except for K-pop, of course. Their population is 50 million. We have around 330 million. On March 1st, 2020, South Korea had about 3,700 confirmed cases. Italy, the first hotspot in Europe, had 1,700, and the US had just 32 cases. I know, it doesn't make any sense. We only had 32 cases because we didn't have any testing going on. By the end of April, Italy had topped 200,000 cases. The US finally had a true number, we were above 1 million, and South Korea still had fewer than 11,000 cases. South Korea's first wave of coronavirus cases was about 1/10 as big as that in the United States. They did very aggressive case identification and contact tracing. Sometimes to beat an epidemic, you have to give up some personal liberties. More recently, South Korea got slammed by Omicron, but because it has such a high vaccine rate, it has one of the lowest case fatality rates in the world, and they never really did a lockdown. While diagnostic testing is an important tool for helping to reduce the spread of COVID, there have been challenges in scaling up testing in the US throughout the pandemic, and we have done a horrible job of scaling up rapid home tests. Rapid home tests have been identified as an important public health intervention for controlling COVID. It took us over 18 months to make such tests available. In order to break the chain of infection, you have to identify the infected people, and you can't do that without tests. We have all dealt with the difficulty of trying to find a test, and sometimes we often have to pay high amounts just to get one. So we took an early stumble on tests, and then we started on treatment, and things went more wrong.
Maybe than anybody, but I'm a big fan, and we'll see what happens. And we all understand what the doctor said is 100% correct. It's early, but I've seen things that are impressive, and we'll see. We're going to know soon. We're going to know soon, including safety. But, when you get that safety, this has been prescribed for many years for people to combat malaria, which was a big problem, and it's very effective. It's a strong drug. So we'll see.
Effective against SARS.
It was, as I understand that, is that a correct statement? It was fairly effective on SARS.
John, you've got to be careful when you say fairly effective. It was never done in a clinical trial. They compared it to anything. It was given to individuals and felt that maybe it worked. So
was there anything to compare it to?
Well, that's the point. Whenever you do a clinical trial, you do standard of care versus standard of care plus the agent you're evaluating. That's the reason why we showed back in Ebola why particular interventions worked.
Sir, on that topic. About the possible therapies, yesterday, Mr. President, you said that they were for, quote, immediate delivery. Immediate. We heard.
Yeah, we're ordering. Yes, we have millions of units ordered. Bayer is one of the companies, as you know, big company, very big, very great company. Millions of units are ordered, and we're going to see what happens. We're going to be talking to the governors about it, and the FDA is working on it right now. The advantage is that it has been prescribed for a totally different problem, but it has been prescribed for many years, and everybody knows the levels of the negatives and the positives. But I will say that I am a man that comes from a very positive school when it comes to, in particular, one of these drugs, and we'll see how it works out, Peter. I'm not saying it will, but I think that people may be surprised. By the way, that would be a game changer. But we're going to know very soon. But we have ordered millions of units. It's being ordered from Bayer, and there is a couple of companies also that do it.
For clarity, Dr. Fauci said there is no magic drug for coronavirus right now, which you would agree. I guess on this issue, then,
I think we only disagree a little bit.
Sorry.
I disagree. Maybe and maybe not. Maybe there is, maybe there isn't. We have to see. We're going to know.
Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope?
No, I don't think so.
Presenting preparedness right now.
No, I don't think so. I think that it's gone.
The not yet approved drug.
Such a lovely question. Look, it may work and it may not work. And I agree with the doctor, what he said. May work, may not work. I feel good about it. That's all it is, just a feeling. I'm a smart guy. I feel good about it. And we're going to see. You're going to see soon enough. And we have certainly some very big samples of people. If you look at the people, you have a lot of people that are in big trouble.
These scenes played out constantly during the early stages of the epidemic. Trump would introduce a treatment development. Fauci would come to the podium and throw ice on it. Then Trump would try to warm the idea up again. Hydroxychloroquine got early FDA emergency use authorization in March of 2020. No studies to support it, and when it was studied for treatment for COVID, it was determined it doesn't work. Remdesivir, the first FDA-approved COVID-19 drug, was approved for emergency use in May of 2020 without any significant studies to show efficacy or safety. Remdesivir was a shelved Ebola drug that wasn't effective. It is manufactured by the multi-billion-dollar Bay Area pharmaceutical giant Gilead. Here's the problem. It doesn't decrease mortality, nor does it shorten hospital stays. Put simply, it doesn't work. But Gilead has made nearly $6 billion off the drug so far. We also tried monoclonal antibodies. Monoclonal antibodies are antibodies created in a lab that target the antigen of interest, in this case, the COVID spike protein. They are very expensive at around $3,000 per treatment, and their results are mixed. If given very early to high-risk patients, they may reduce hospitalization. But if you are already sick with COVID, they don't do much and don't save lives. They were thought to be a game changer, but not so much. And they don't do squat against Omicron. One of the companies, Regeneron, that makes the antibody cocktail has made billions.
The SARS-CoV-2 pandemic was the speed with which we were able to identify what the causative agent was. The Chinese recognized the epidemic. They probably were aware of it as early as October, but they didn't really recognize it until December. And by the end of December and the beginning of January of 2020, they actually identified the agent. And by identifying the agent, they then opened the door for development of a vaccine. So ultimately, vaccines are one of the great advances of the 20th century. But the development of a vaccine is not enough. You've got to know how to use it.
The operation was a success, but the patient died. Yes, Operation Warp Speed, though the Biden administration has banned the use of that descriptor, did help develop several somewhat successful COVID vaccines in 2020. Starting in May of 2020, Operation Warp Speed provided billions in research, manufacturing, and distribution support towards the cause of making 300 million vaccines available to the public by the end of 2020. That pretty much worked out. And yes, these vaccines have reduced hospitalizations and deaths. Basically, the people dying from COVID in 2021 were the unvaccinated. While there has been much skepticism and concern about the vaccines, they have been relatively safe and very effective. Have there been side effects? Well, all vaccines have side effects, and for some, the side effects have been pretty severe. Blood clots, heart inflammation. These vaccines use mRNA and DNA technology to get your cells to make COVID proteins, which then inspire your immune system to make antibodies against these proteins. They're supposed to go in, do their job, and get out. That's the idea, but we haven't had enough time to study their full effects. But other countries did their version of warp speed as well. China, Russia, Germany, and Britain developed vaccines in 2020. BioNTech, a Pfizer partner, is a German company. Moderna is a U.S. company with a long history of government support. The technology and components they use in their vaccine really wasn't developed by them. Most of it comes from research that was supported by, you, us. And some of it comes from other companies, which is why they are getting sued. Moderna, Pfizer, and others will make billions and billions off of these vaccines. The NIH funds billions in research annually, and yes, the NIH and often their university partners hold patents to many of the technologies used in the COVID vaccine. There is a public-private partnership per se, but the public partner shows up in a Kia and the private partner drives away in a Bentley. Kathleen Carrico, Senior Vice President at BioNTech and considered to be the mother of the mRNA vaccine, grew up in Hungary, daughter of a butcher. At a young age, she decided she wanted to be a scientist, but she had never met one. She moved to the US in her 20s to find a science job, but for decades never found a permanent position. She clung to the fringes of academia, barely making a living working as a researcher at various universities in the US for 30 years. She ultimately landed a job as Senior Vice President at BioNTech in 2013, and the rest is history. She was one of the first people to receive the vaccine she developed. So we have a few approved vaccines, yet 1 out of 3 Americans has been infected with COVID. Around 1 million people have died, and many others will suffer lifelong disability. The vaccines were supposed to prevent infection, yet many people get infected. One of those people is Dr. Fauci, who has been vaccinated and boosted twice. This has led to further skepticism about these vaccines. The operation was a success, but the patient died. There were tremendous problems rolling out the vaccines. The mRNA vaccines were problematic because they must be kept frozen. And in a way, we ran out of ice. There were a myriad of other rollout problems, so our public health system had to subcontract to get needles into arms. The government also tried mandating the vaccine for some, and that blew up and made even more people angrier about the vaccines. But the biggest problem was that many people had become skeptical of the vaccine because they had heard, frankly, a lot of nonsense from the CDC and also from Trump and then from Biden. They no longer trusted the messenger, and you don't get a second chance at a first impression.
In China, they've opted for the lockdown situation, 0 tolerance for the disease. And they've been reasonably successful. I mean, they have sporadic outbreaks, including in their biggest cities, Shanghai and Beijing, recently. But it's been at a tremendous cost. It's affected their GDP, and it's gone down. They're having an economic problem because of lockdown and the supply chain, et cetera, et cetera. And they've got tremendous psychological problems. I mean, we see those psychological problems in this country. And while we did, to some extent, use the original public health interventions of isolation and quarantine, we didn't implement it with the ferocity with which Xi Jinping has implemented it. So I have colleagues in China, and what I'm trying to suggest to them is that they've got to come to some sort of balanced approach where they don't destroy the country.
Another intervention we tried was lockdowns. While theoretically not a bad idea, they have some serious consequences to them and maybe, just maybe, actually don't ultimately control the spread of COVID and related mortality. And lockdowns have been especially cruel to children, the least likely to become ill or die from COVID. Teen suicide rates have hit an all-time high. Scientists and economists have found that voluntary behavioral changes are 10 times as important as mandatory measures in limiting the growth of a pandemic. When people feel they are at risk of something, they change their behavior. People, for the most part, are intelligent. And ironically, those who stayed at home ended up with higher infection rates. Maybe spending time outdoors would have been better, but oh yeah, they closed the parks and beaches. Florida was an open state, and California and New York were lockdown states. They ended up with similar mortality rates. Lockdowns did not make a difference. While lockdowns have little to no public health benefit, they impose enormous economic and social costs. Job losses in the United States in March and April of 2020 exceeded 22 million, and we have not fully recovered from that. We also made arbitrary distinctions between essential and non-essential workers. Essential workers, often lower income, took on greater risk of COVID infection, and so did their families, to maintain some financial stability. And designating one business as essential and another as non-essential shifted consumer activity to favor those categorized as essential, thus wiping out many businesses, and those businesses have not come back.
This being set up for a movie company. I'm losing everything. Everything I own is being taken away from me. And they set up a movie company right next to my outdoor patio, which is right over here. And people wonder why I'm protesting and why I have had enough. They have not given us money and they have shut us down. We cannot survive. My staff cannot survive. Look at this. Tell me that this is dangerous, but right next to me as a slap in my face, that's safe. This is safe. 50 feet away. This is dangerous. Mayor Garcetti and Gavin Newsom is responsible for every single person that doesn't have unemployment, that does not have a job, and all the businesses that are going under. And we need your help. We need somebody to do something about this.
We need to make sure that everybody continues to let us know where those folks are. If you've observed recurring violations of the Safer at Home order, please continue to let us know at coronavirus.lacity.org/business violation. You know the old expression about snitches? Well, in this case, snitches get rewards. We want to thank you for turning folks in and making sure we are all safe.
We will shut you down. We will cite you. And if we need to, we will arrest you and we will take you to jail. Period.
Look. He ain't even do nothing. He's violating. He ain't even do nothing. Look. He ain't even do nothing.
So the reset will be this. We start with the fundamental notion. The NYPD is here to protect lives, to save lives. And where we see the greatest danger to lives in terms of the coronavirus and the area where we can enforce is around gatherings, particularly large gatherings.
Because of lockdown, children lost years of educational and social development that will affect them for the rest of their life. Psychological problems have soared throughout society, and Johns Hopkins researchers have concluded that lockdowns should be rejected as a public policy practice for pandemics.
In the initial phases of the epidemic, Sweden said, we're going to let people go for natural immunity, and they failed. It did not stop the epidemic.
Sweden tried a no lockdown policy when COVID first hit that ultimately did not work when they were hit with the Delta wave, but overall their mortality rates have not differed much from the UK, where they employed sporadic lockdown.
It's going to be interesting to see what happens with New Zealand, I think, which basically shut its borders. And although it did not go into lockdown to the extent that China did, they've now opened up. And so it'll be interesting to see what happens with them. And I believe they have a high vaccination rate as well.
Yeah. New Zealand has handled COVID quite well. They were a lockdown country, but they're also very serious about testing and contact tracing. They also restricted travel and employed quarantines for returning New Zealanders. By January 2021, the country of 5 million people had only 2,200 confirmed cases and only 25 deaths. New Zealand's efforts to combat the spread were orchestrated using an all-of-government approach. While their approach has been restrictive, they were able to secure popular support for their efforts. New Zealand took a hit financially, but I suppose or hope people dying is a much worse outcome than an economic downturn. And we tried masks. Oh gosh, where do I even start with that? Let's start with Fauci's own words.
There's a lot of confusion among people and misinformation surrounding face masks. Can you discuss that?
The masks are important for someone who's infected to prevent them from infecting someone else. Now, when you see people and look at the films in China and South Korea, whatever, everybody's wearing a mask. Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
And can you get some schmutz sort of staying inside there?
Of course. But when you think masks, you should think of healthcare providers needing them and people who are ill. The people who, when you look at the films of foreign countries and you see 85% of the people wearing masks, that's fine. That's fine. I'm not against it. If you want to do it, that's fine.
But it can lead to a shortage of masks.
Exactly. That's the point. It could lead to a shortage of masks for the people who really need it.
And then he said,
people who are vaccinated when they are in an indoor setting, that they should wear a mask.
And then he said,
if in fact you are vaccinated, fully vaccinated, you are protected, and you do not need to wear a mask outdoors or indoors. That even if you are vaccinated, you need to wear a mask in indoor public settings. That we were thinking we would run out of masks and other things for them. So the recommendation was not to wear a mask because of the shortage of it. Two things happened. One, it became clear that we had enough of the equipment. When the children go out into the community, you want them to continue to wear masks. The children outside, particularly when they're with the family, walking down the street, playing a game or what have you, don't have to wear a mask. The Academy of Pediatrics actually makes that recommendation that children should be wearing masks from 2 years old.
I mean, I think I've got this right. 1 mask is better than 0 masks. 2 masks is better than 1 mask, but you don't have to have double masks. Is that right?
Make sure you wear a mask. So you wear a mask. Then you want it to fit better. So one of the ways you could do it, if you would like to, is put a cloth mask over, which actually here and here and here, where you could get leakage in, is much better contained.
Okay.
That's all they're saying. 1 mask at least, but if you want to really be sure, get a tighter fit with the second mask.
Wait a minute, are you a double masker, Dr. Fauci? It looked like you are.
By the way, let me show you. See this? This is what I do. You have it on, you go like this, bingo, and you're okay. Then you go like this, bingo, it's up.
This way. Yo, that's unnecessary. Come on, she got a kid with her. She got a kid with her, man. That's too much, man. You're a female.
Hard to find N95 masks that fit.
Right.
Fit the face masks were hard to find, and and the gowns were getting harder and harder because there was so many admissions.
Right.
So there just wasn't enough. They're underprepared with the masks, underprepared with the PPE. So when you wear these equipment working in a closed area, I wore glasses. My glasses would fog up, so I couldn't see anything. Right. So I'd have to pull my mask down to clear my eyes, and maybe that's how I got the COVID, because in the emergency room, everybody had COVID. There was a lot of misinformation, and because they kept giving contradictory information themselves. Like Fauci would say one thing one day, another thing the next day. I just started not believing anything he said.
Quote, trust begins with truth and ends with truth, right?
Yeah. And I think his credibility was really, compromised when it found out that under his leadership, the NIH had been giving millions of dollars to the Wuhan lab to develop a gain-of-function virus.
Sure, yeah.
I mean, all that smelled rotten. And the fact...
And no proper investigation of that lab, right? And the world, and then we lost our relationship with the World Health Organization because they seem to be taking a China side on this.
Right. They seem to be saying the Chinese Communist Party, is correct. It didn't start in the lab. Well, what's it saying? It looks like a duck. It walks like a duck. It's probably a duck. And they were getting millions of dollars from Fauci's NIH to do this research. I don't think it was, let out deliberately, but it got let out. And, and then the Chinese hiding it from everybody.
Right.
There's a saying, trust begins with the truth and ends with the truth. Nobody could figure out what to believe about masks and respirators because the CDC told so many stories. Fauci was the anointed public health doctor in the United States. And then those questions about his role in the Wuhan laboratory began surfacing on social media. And then he was lost to at least half of the people in the United States. So people started going their own ways. Only properly fitted N95 respirators truly protect you from getting COVID or passing it. And those are really difficult to wear when worn properly. They tax your lungs, as do other types of masks. Air easily escapes and enters from the edges of most masks. Cloth masks are a joke, yet they were promoted by the CDC.
Next, we're going to try a cloth mask. Remember, we want to stop this moisture that's coming out of our mouth because that's what COVID rides on. Here's one. Here's two. Next, we're going to try an N95 with a cloth mask. There's one. Here's a cloth mask on the N95. Now we're going to try two N95s.
We started the epidemic with a shortage of PPE, especially N95 respirators. And when we got the needed PPE, we couldn't figure out who was supposed to use it. And let's not forget that China made billions selling us PPE. Yeah, the place where COVID started. We drove people away from each other, put people in masks, and yet somehow we still ended up with 100 million COVID cases and 1 million deaths. Organization, we stunk. Science, so-so. Communication, just awful. They end up being kind of random or arbitrary. Maybe they believe that they're trying to help people, but the reality is, for the most part, at this stage, they're just hurting people.
If If you travel abroad, soon you won't need a COVID test to get back into the U.S. CDC is dropping the requirement for all incoming air travelers on Sunday. Puts an end to one of the last travel restrictions of the pandemic.
And the chief medical advisor to President Biden, who leads the administration's COVID response, has tested positive himself. The NIH announced today that Dr. Anthony Fauci tested positive for COVID-19 on a rapid antigen test. 81-year-old director of the National Institute of Allergy and Infectious Diseases is fully vaccinated and has been boosted twice.
More than 1.6 million cases of reinfection have been reported across 24 states, and those numbers are still climbing.
So how do we do a better job when the next epidemic comes around? And like I said, we will have another epidemic. As I noted earlier, the response to these infectious disease events involves organization, science, and communication. What is that saying? An ounce of prevention is worth a pound of cure. To best respond, you have to prepare, then over-prepare, then over-prepare. We ran an exercise, Operation Crimson Contagion, that had some major findings, but we did not act on those findings. The people in charge were not in charge. So the public, you and me, have to get involved because we are the ones ultimately impacted. We have to ask our officials now, what is the plan for the next epidemic? Are we prepared? Do we have enough PPE? It's like sometimes the kids have to tell the parents how to do things. The CDC and other government agencies have to get involved in the science. And lastly, what did Hippocrates say? First, do no harm. If you don't know what you're talking about, if you're not rooted in the science, if you don't have clinical trials to provide evidence that something works, then you can't say anything about it until you have that proof. Throwing out half information in the middle of an epidemic, middle of a pandemic, did so much harm. And we also have to have better cooperation among countries, whether it's through the World Health Organization or otherwise. We have to figure out where these infectious disease outbreaks are occurring so we can get ahead of these outbreaks. We had and have a bad relationship with China, and that relationship definitely impacted us.
The recent SARS-CoV-2 epidemic really illustrates the problem and the need for communication.
We have to communicate. Communication is the key.